Thanks for staying with us on The Real Story. Just last week, UConn settled their insurance dispute with ConnectiCare. But what does this actually mean for patients and the future of the UConn Health Center? UConn Health CEO Dr. Agwunobi is joining me now to talk about it. Thank you so much for being here, Andy.
Thank you. It's great to be here.
So, as we said, UConn just settled this kind of much publicized insurance dispute with ConnectiCare. I know the contract expired back in April. So tell me a little bit, first about what some of the details of this contract are and what it kind of took to get to this spot.
Yeah, well, we're very happy that ConnectiCare has worked with us to make sure that we have a contract. And what this does is it means that we will have fair rates, fair payments for the absolutely amazing care that's given by UConn Health every year. I mean, if you think about it, UConn Health has been named one of the top 100 hospitals for maternity care. It's one of the world's best hospitals by Newsweek. Wow. Has 9 straight A's for safety ratings every 6 months. And I think one of only a few hospitals in Connecticut that's ever had that. Yeah. And yet you could say that we're a bargain because we're also reimbursed very low by the managed care companies. And that's okay if, it's okay for companies to make a profit, but when you're dealing with a taxpayer funded organization, and we get 8% of our revenues from taxpayers.
Wow.
So that's a different lens to look at it through, and we have to be fair. So we're just glad we're there, and it's the start of a process with other managed care payers.
And as you said, we know UConn Health has had some of the lowest, reimbursement. The reimbursement rate is some of the lowest behind all the different hospitals here in Connecticut. But we know medical costs are rising as well. How are you sort of balancing that, with care moving forward?
Yes, well, that's one of the reasons why we have to be we have to really go to the managed care companies and say, look, fair payment is important because one of the things about UConn Health is we're the only public academic medical center in Connecticut.
Right.
And so we're all about quality, safety, cutting edge technology for the people of Connecticut.
Right.
And that costs money, and that's something that we have to be fairly reimbursed for.
Yeah. And tell me a little bit about what this would mean now for taxpayers, for the state, and going forward for the future of UConn Health.
Well, what this means is that we can be on a solid path towards being a strong financial partner for the state and making sure that we continue to invest in technology, medical care, quality care for the people of Connecticut.
What do you want patients to know who were kind of in limbo over this past, 2-3 month break, sort of wondering where this all stands for them? What do you want them to know now?
Well, what I want them to know is that there'll be no disruption of care, that whatever was scheduled for them before will continue, and we're just really happy that we're able to serve them. That's what we're here for, and that's what our primary focus is.
And so in other health systems and hospitals that I've spoken to over the past few years, as I mentioned, we know medical costs are rising, and when it comes to working with the state, hospitals at the end of the day, are still a business to make sure everything's running smoothly. Is there any insight you can share for patients when it comes to that aspect of it?
Yes, I would say that sometimes when patients hear about we're having this dispute with managed care companies, they think it's really about business. And in some ways, the way I would say it is that when you have a public academic medical center like UConn Health, and you're providing the top-notch care for the people, being paid below what a rural hospital is paid is just not fair.
Right.
So we're not saying we have lots of payments and we want more. What we're saying is we're just asking to be paid fairly, which is I think reasonable.
Gotcha. So in some other kind of medical news, we know June is also Cancer Survivor Month. So can you share a little bit about what we're seeing when it comes to some advances in early detection or detection in general right now as we kind of look at this month?
Well, cancer is a terrible thing for anyone to go through, and there's about more than I think CDC says more than 2 million people will be diagnosed with cancer this coming year. So it's important to have the usual things like prevention, such as diet, exercise, etc., avoiding tobacco, alcohol. But screening is really important, and that's where I think UConn Health is extremely strong. We have a very, very accomplished group of specialists looking at whether it's breast cancer, we just have a new doctor, Dr. Mitchell, who's coming in, whether that's prostate cancer in our urology department, lung cancer. We have a fantastic surgeon, Dr. Dustin Walters, and his colleague, Dr. Omar Ibrahim, who are very attuned to the treating lung cancer patients. But most important is just coming in for screening. And I would say, particularly now that it's so sunny outside and everything, is that people should think about screening for skin cancers. Like we have this new program for melanoma run by Dr. Margaret Callahan and Dr. Fan. It's really important. And we have a very strong dermatology group, more than 25 dermatologists. And I think they would agree with me that coming in for screening for moles, other abnormalities on the skin is really important when it comes to cancer care.
Now, something else really interesting when we talk about, the future of UConn Health that I did want to bring up. We know the legislative session just ended about 2 weeks ago.
Yes.
So very fresh still. And then there was a bill that was passed during the session creating a Center of Excellence for Veterans at UConn Health. So before we get into some of those details, just give us a quick overview of what that means. What is that?
We're very excited. We all love our veterans and we owe them so much. And so it's a great thing to be able to have a Center for Excellence for Veterans. We have a surgeon called Dr. Connor, a neurosurgeon, who has partnered with this medical device company to implant, and it's really, really cool. It's, you implant a device just under the skin, and a coil goes to your vagus nerve, and you have a magnet in your hand, and you wave it over that device, and it's the vagal nerve. And what it does is it helps you to regain control, regain function after a stroke. So people who have had a brain bleed, and they have maybe paralysis in their upper arms or something like that, it helps you to regain that function while you're doing physical therapy or you're doing just activities of daily living around the house. So we're going to be able to bring that to veterans in Connecticut. Dr. Connor is the only surgeon doing this surgery in Connecticut. And of course, we bring it to others too, not just veterans, but others that have had strokes.
And as you mentioned, this is for others who've experienced strokes as well. But
for anyone who's experienced strokes. But there's this particular Center of Excellence that we're developing with our Brain and Spine Institute that's dedicated, based on this legislation, which came with some dollars for 2027. We will definitely be rolling it out and really excited to do that for veterans. Yeah,
$2 million, as you mentioned. Why this focus on veterans for the $2 million, and why is that so important to have?
We just think, partnering with the VA, the Veterans Administration Hospital, and the Task Force for Veterans Disability, just to make sure that we're really focusing on that important population, the veterans, and we're giving back to them. As well. So it's really important. So yes, we're going to bring this technology to everyone, but with this legislation, we can start with the veterans, and we think that's really important.
And I do know there have been, I believe, a few patients who have gone through this already at UConn Health. Can you tell me about what that experience has been like and the successes they've seen?
Yeah, it's been fantastic. I was at a Veterans Disability Task Force meeting to launch this whole program that we're doing, and 2 of the patients of Dr. Connor came to that event, and it was just inspiring to see how they could now use their fingers and do things that they couldn't do before. It just makes it all worthwhile. That's why we're in this business.
Absolutely. So, this device that you were talking about and, how it's implanted makes it 2 to 3 times more likely to have that, extremity function. Can you tell me a little bit about how it came about, this partnership with you all and this specific device technology?
Right. Yes, this device technology has been it's been around for about 15 years, but it really needs to be, you need a neurosurgeon, someone that really understands the stroke rehabilitation care, etc. And it's a whole team. And so we're always looking for new technologies. That's the bottom line. We're always trying to introduce new technologies into Connecticut for the people of Connecticut. And that's how this surgeon brought this technology to us. We started using it. And we saw great results, and we're just moving ahead.
So I believe this is going to be fully rolled out by 2027, correct? So only 2 years from now.
Well, the funding, yes, is going to be 2027, but we've already started the procedures. We're partnering with others, some of the physical therapists, occupational therapists in Hartford Healthcare and others. So we're already doing it, but the particular Center of Excellence for the veterans will be funded with the $2 million starting in 2027.
Do you know how many veterans that will be able to help?
I think it'll be about 10,
Wow.
10 veterans to start off with.
Wow.
But again, this is just rolling it out, and I think as many have said, including legislators, this is just the beginning.
And what do you want people to know if they want to learn more, they're interested in potentially, you know, maybe applying for this?
I would say contact our Brain and Spine Institute. You can go through our website. And let us know that you're interested. You might have a loved one. And by the way, it can be used for functional problems that have been ongoing for 5 years.
Oh, okay.
So a family member may have had a stroke 5 years ago, or
right.
6 months ago, or 2 years ago, and is still not having as much function in their arms and their fingers and their hands as they would like.
Right.
This is still applicable to that. So
Gotcha.
I would certainly reach out to our Brain and Spine Institute, and we'd love to help.
It doesn't have to be something that just happens.
No, not at all.
Right. So tell me, you know, in our last 2 minutes here, what else is on the horizon for UConn Health? What do you want people to know about?
I just want people to know that, well, one, I want people to be careful because it's very hot outside. Make sure that, as they say...
Yes, I know this is kind of our first big heat wave.
Right, as they say in the CDC, you know, stay cool, stay hydrated, and stay informed. It's really important.
Yeah.
But in terms of UConn Health, I would just say this UConn Health has been named and is definitely one of the best health systems in Connecticut. And I want people to understand that that word public before the academic medical center means that UConn Health is for you. So even though we're in the Farmington Valley area and the greater Hartford region, no matter where you are in the state, all people from the whole 169 counties and towns in the state come to UConn Health every day. And we want you to come, and we want you to be welcome, and you'll get the best care.
And for anyone who maybe is concerned right now, as we mentioned at the top, from previously having that little limbo with ConnectiCare, or who are seeing, you know, what's happening right now with possible cuts to Medicaid coming from a federal level, what do you want patients to keep in mind?
Again, it gets back to being a public medical center. We take everyone. So we take, you know, whether you have Medicaid, whether you have Medicare or commercial insurance. We don't just take patients that have those. We're happy to take them, and it's our mission. And so give us a call, try us out, and I'm sure you'll love the care.
Well, Dr. Andy, thank you so much for checking in with us and kind of running us through. As you mentioned, a good tip for people is the kind of first big heat wave is happening, but we appreciate you taking the time.
Thank you so much. Thank you for having me.
Of course, that does it for us here now on The Real Story. But of course, if you want to watch these segments again, you can head to fox61.com or download the free Fox 61 News app and watch The Real Story every Sunday at 10 a.m. right here on Fox 61 and streaming on Fox 61 Plus. Have a great morning.